Welcome to Clyde Health Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions, treatment options. My guest today is Dr. Indrajit Majumdar, the Medical Director of Children's Healthy Way of Buffalo at the Oshai Children's Hospital. In this special two-part series, we'll be talking about childhood obesity and treatment available through the Children's Healthy Way of Buffalo. I'm Mike Hughes, and this is Medically Speaking. Welcome, Dr. Majumdar. Thanks for joining us today. We're here to talk a little bit about obesity, especially in children. But as we get started, maybe you could talk a little bit about the epidemic that's growing in both children as well as adults.
Obesity has been affecting a significant population in the United States. In adults, we know that a third of the population have obesity. We're talking about individuals with BMI more than 30. We're not talking about the individuals who are slightly overweight. In kids, unfortunately, they have been following the same trend. So the current statistics says 1 in 5 child is obese, which makes about 18% of our population. It affects children as young as 2 years of age.
Yeah. So you mentioned BMI. So for those who are out there watching, explain what BMI stands for.
BMI stands for Body Mass Index. You're adjusting the weight for the height, because as you get taller, your weight gets more, so you have to adjust for the height. It is a good assessment for being overweight or obese, but in kids it gets kind of tricky because kids are growing in height, so you have to adjust that by putting it on a percentile, and if you're more than 95th percentile, that is in the upper extreme, only then will you be considered overweight and obese. Unfortunately, it does not take into account the fact that you may weigh too much because you have more muscle mass than fat mass.
Right.
So it's a tricky thing to use in kids.
Right. So you said more than 30 in the BMI and how obesity can affect kids. So talk a little bit more about what specifically those effects are.
Obesity is a condition, in fact, a disease as defined by American Medical Association, which has so many biochemical changes that it affects almost every system of your body. Now, in adults, we talk about diabetes, heart disease, cholesterol problems. Unfortunately, that affects kids. I have young kids coming to my diabetes center, additionally, for treatment of diabetes, type 2, adult type diabetes. But those are the things that we know of. The things that we don't talk about are things like the liver disease that affects young children. And this is going to be one of the leading causes of liver transplant later in life.
Right.
Women have problems with infertility. Obesity has been linked with certain types of cancers. It can cause a lot of changes in the psychosocial behaviors. Children struggle with extreme behavioral challenges as a result of the obesity they're facing.
Right. It's a growing problem, maybe bordering on an epidemic. Here in Buffalo, Oshai Children's Hospital has developed a pretty unique program, kind of a one-of-a-kind, both medically and surgically, how you're addressing this epidemic. Talk a little bit about Healthy Way and what that is.
So Healthy Way is a unique multidisciplinary program. When we talk about multidisciplinary, it is something where instead of you going and seeing 4 different providers, we bring all the providers together at one place. So in addition to me, I'm additionally a pediatric endocrinologist. We have a registered dietitian. We have exercise physiologists who are trained occupational therapists and physiotherapists. We have psychologists, clinical psychologists who are trained in kids with weight management problems. And for the children struggling with extreme obesity, with multiple health problems, we have our surgical colleague to perform weight loss surgeries for the select population.
Sure. So you're bringing care coordination and a team approach to the patient. So there's both the medical and surgical side. We'll save surgical for part 2 of our interview, but if you can, start with the medical side and how you address these issues from a medical perspective.
So clearly, obesity affects multiple systems because of the multiple problems that I stated earlier. But the challenges with obesity management there's been a extreme focus on diet and dieting and oversimplification of the treatment of this condition. We say that, hey, this individual is struggling with obesity. You should diet, you should exercise, you'll be fine. That's the general message.
Sure.
Without addressing the underlying problem. The poor kid who's unable to control the appetite, you telling that kid to diet, that's intrinsically and logically probably wrong.
What are some of those underlying issues that you find?
There are so many conditions. Some of this obesity is a genetic condition. Some genes may drive the way you feel about yourself, your hunger. Hunger control may be different. We know that there are over 100 genes out there which can affect your appetite. There can be conditions where there are social stresses which are affecting the way you eat. Unless you address those conditions,
Sure.
It's wrong to tell a child to diet.
Right. So the program has been going on now for a few years now. Talk a little bit about some of the successes that you've seen.
So our patient population is definitely the extremes, and the children who've not lost weight in any other program, they're the ones getting referred. And in the last year itself, we saw close to 1,000 kids. And we went back and looked at our data, and in these children who had never lost weight, over 66% had a decrease in their ZBMI.
Sure.
And another 15% had ZBMI stabilization. And again, these are the kids who had never lost weight.
Sure.
These data we actually presented in international conferences.
Gotcha. So if you're out there watching this, you're a parent, you're a grandparent, and someone would like more information about the program, how does someone go about getting connected to the Healthy Way?
So your pediatricians know very well about our program. We reached out to all the pediatricians that were very well aware of Children's Healthy Way of Buffalo. If you go do a Google search, Children's Healthy Way of Buffalo, it comes up straight over there with all the details. But the best way is talk to your pediatrician and they can refer your child to us.
Great. Doctor, thanks for joining us today.
Thank you very much.
I'm Mike Hughes. We'll see you next time on Medically Speaking. Please be sure to join us for part 2 on the Buffalo Children's Hospital's Healthy Way.